The main complication is undoubtedly pneumonia. A lot of the very small children, measles, it affects the immune system, so you're unable to fight infection as well as you normally would be. And on top of that, the measles itself can damage the lungs, and if you get a bacterial infection on top of that, then it can cause very severe pneumonia. And that's really what we've seen in the vast majority of the children who have become critically unwell and those that have died, unfortunately. Those types of pneumonias need complex, challenging treatment. We sometimes have to put plastic drains in to drain the infection out, and they have to be on very strong antibiotics given through the veins. And that's a lot for a small child to take, and it's very difficult to sustain that for a long period of time. So that's really been the main complication. We have seen other complications of the measles, what we call encephalitis, in other words, affecting the brain, and seizures, but really the pneumonia has caused by far the largest impact. At this stage, there is undoubtedly a chance that there will be a burden of those children who have had those very severe infections, the ones who have survived to get out of hospital, that they will go on to have some more problems, I guess, in the future. But at this time, we're really dealing with the acute pneumonia, so trying to get them better from that and get them out of hospital. The staff from Australia and the Samoan staff have really worked astonishingly well to give care and compassion to those families. It's a very difficult time, it's exhausting, people want to spend the whole time with their sick children, and in Samoa, I don't need to tell you that involves grandparents and aunts and uncles and brothers and sisters and cousins, and so the families have been so supportive, and our staff, I think, have been able to try and treat the children when they can, and when that treatment is not successful, they've been able to deliver, compassion and communication and care for those families. We don't want to spread measles any more than it already is, so it's really important that people take heed of that notice. But we equally understand that it's very difficult to look after a very sick child, and there's lots of responsibilities. So I think everyone works pragmatically to make sure that we both try and reduce the spread of measles, but also that we treat parents and families compassionately.